Okay, on behalf of Ravindra Psychotherapy Research Institute Trust, I welcome you all to today's 87th Sunday webinar. This Sunday webinar will focus on the analytical music therapy. So initially, I will present you the description of the music therapy. So what is music therapy? What are the types of music therapy? And different analytical music therapy techniques. So if you have any question, please you ask me.
Sir, I think you should go ahead as you like it, because we would question in between or maybe in the end whenever you finish. Okay, sir.
Definitely. You can ask me any question, whatever comes to your mind.
Okay, thank you, sir.
So first we will learn what are the myths about the music therapy. There are a lot of the myths about the music therapy. Next, we will learn the definition. Next, the properties of music therapy. So when you want to give the music therapy, then what are the things you have to remember? Then the types of music therapy. After that, the three analytical approach. One is the psychoanalytic approach. Another one is the behavior therapy approach. And the next one, Ravindric psychotherapy approach. Some of the common quotes of music therapy. Music is our common energy. Okay, so music is treated as the energy. Add music to your life every day. What does your musical life consist of? Andrew Pacioli. Another one is the music is our common energy. Add music everyday life. Oh, so these are the common quotes. Very. I'm going to another one. So what are the myths about music therapy? First one, any sound can be applied in music therapy. This is totally a myth, because in music therapy, you will find that is the music therapist drumming some instrument or playing some instrument, and other people are also imitating the therapist. Okay, and they are smiling, they are laughing, etc. So the people are saying, okay, this is the music therapy, but this is not the music therapy. This is basically the sound therapy, or you can give the musical experience to this sound. So when you beating the drums and you are thinking that is other people are playing with the drums, that means this is the music therapy, but this is not the music therapy. In most of the time, we find that is the in case of the music therapy to the autistic children or the children with some special needs. Usually, we find that is they are the drumming. Okay, they are beating the drums. And we are thinking, so this is the music therapy. But this is not the music therapy. Okay. It provides the musical experience. You can talk about the sound therapy. It, it is not the music therapy as such. So sound can give musical experience, but it is not therapeutic. Sound or musical experience and therapeutic experiences are different. So we must be very much clear about the sound therapy and the music therapy. Two things are different. For music therapy, case history taking is not necessary. Many people are thinking, okay, you come and you beat the drums or you play some music. So yes, this is the music therapy. No, this is not the music therapy. In case of the music therapy, you have to take the case history, number one, and you have to take the mental status examination. These two things are very important in case of the music therapy. Another issue that in case of the music therapy, you always make some research design. That is the pre, during, and the post. What is the pre? That is the people who want your help. Okay. You have to collect some data about them or about the individual case also. If the patient or if the client comes to you with some of the symptoms, okay, you will consider all of them and that will be your pre. Another one is the during. During means maybe you have the 10 sessions or you have the 15 sessions. Okay. So whatever the sessions you have to consider the change in the consciousness level of your client or the patient. And the next one, that is the after. That means when you have stopped the music therapy sessions and after 7 days, okay, you will collect some data from the client. So this research design provides you the knowledge about the effectiveness of your music therapy. If you have any question, you can ask me. Another thing, music therapy is changing mental experience only. So this is the assumption, that is the music therapy changes our mental experience. It is not related to our changes in the body or in our physiological system. So this is another myth. No, it has the impact on the change in physiology as music affects mind and body interaction experiences. Okay, so there is an interaction between mind and body. So when there is a change in your mind and there is a change in your body, so music affects your mind or your mental state, and that causes change in your body. Body means in your physiological system. Music therapy can be used as alternative therapy. Yes, this is true. When all treatment fails, music therapy acts as it affects human brain in the coma stage. During the coma stage, human brain is active and music can affect the brain system. Okay. So how music therapy acts on the body? It activates regions of the brain that influence things like memory, emotion, movement, sensory relay, some involuntary function, decision making, and reward. It fulfills social needs for older adults in group setting. So if you can provide the music therapy to the senior people in the group setting, okay, they enjoy, they participate, and their remote memories, some of the pleasant memories, again, that will flashback. So what is happening that it fulfills the social needs. Okay, so people are joining together, people are gossiping with each other. Okay, so most of the times you will find that is the senior people, they are very much alone. They spend their life alone. So if you apply the music therapy for them, then you will find that is they are good in their psychosocial function. Another important issue, that is the music therapy lowers the heart rate and the high blood pressure. It relaxes the muscle tension. It releases endorphins. Endorphins are chemicals or hormone your body releases when it feels pain or stress. They are released during pleasurable activities such as exercise, massage, eating, and shakes too. Endorphins help relieve pain, reduce stress, and improve your sense of well-being. So the endorphin release is very important when you want to manage the uh, stress level. So it relieves stress and encourage feeling of calm. It strengthens motor skills and improves communication for children and young adults who have developmental and learning disabilities. So in this way, music therapy acts on our body. If you have any question, you can ask me.
Sir, so basically, I have got this design as pre-post experimental control group design. So, is there any for the comparison? Is this necessary to keep control group as well?
Yeah, if you can do the control group, then you can apply the placebo.
Okay.
Okay, so you can apply the placebo in case of the control group. For example, instead of the music therapy, you are providing only the sound therapy.
Okay, sir.
Okay, so that design you can make.
Okay, thank you, sir.
So what is music therapy? Music therapy, there is a standard definition given by World Federation of Music Therapy. Use of music and musical elements by a qualified music therapist with a client or group in a process designed to facilitate and promote communication, expression, etc., and other therapeutic objectives in order to meet physical, emotional, mental, social, and cognitive needs. This is very, very important. Okay. So what are the things? Number one is the music. Second one is the musical elements. So we have to study the music. We have to study the music elements. Okay. By a qualified music therapist. Why qualified music therapist? Because the qualified music therapist can regulate your emotion, can regulate your mental function for the therapeutic goals. Okay. With a client, so it may be the individual music therapy you can provide, or in the group or collaborative music therapy you can provide. In a process designed to facilitate and promote communication. This is a very, very important, specifically for the children with special needs, because they are very much afraid of communicating their inner ideas. So by using the music therapy, okay, you can help, you can assist the children for communication, for expression of the inner feelings and other therapeutic objectives in order to meet physical, emotional, mental, social, and cognitive needs. So what is important? I have told you, that is, you have to take the case history. And in taking the case history, you will study the physical need, the emotional need, mental, social, and cognitive needs. So you have to study the needs through the case history taking, through the mental status examination also. Okay. So now I am requesting Ashika, that is, can you share your experience about the autistic children, the needs of the autistic children, because you are dealing with the autistic children?
Yes, sure, sir. So, like you said, that there's a difference between sound and music therapy. So, I just happened to firstly introduce them and form the repo with the sound. I mean, just tried to make them listen to some sounds. So, that proved to be very much disturbing for one of the child. As such, he was very much disturbed already. So, he got triggered. Then I, in the next sessions, introduced the music therapy. In that, sir, I just took some drums. He was again disturbed. So at the third level, I just started introducing a piano. I mean, in the portable piano. So he just started using his hands. And as such, we know that the hallmark of autism, which is not exactly like the main trait, but their hands and their movements are very much restricted sometimes. I mean, their hands like fumble because of that motor movement in coordination. So that started getting better through piano, because the hands he was trying to reach through on the instrument, it just helped him with the soft tone as well as the movement of the hand. So the child started getting happier, which he never earlier was getting happier. So this was one of the case study examples.
Beautiful. So basically what you are doing, that is you are providing the instrument. Okay. And individual client is using the instrument. So without any instrument, can you involve them?
Okay. So
So
like
do you have any instrument now?
right now, no, but in a while I'll have it.
Okay. So can you make any sound that will be the musical sound?
Okay. So will it be possible if I take like 5 minutes to just show how do I conduct it?
Sure, sure, sure.
Okay, sir. Okay.
And Dr. Gangadharan, what is your experience about?
Sir, in fact, I have not much experience in music therapy, but a client who has a schizophrenic patient has come to me. She is taking medications for some 13 or more years.
So do you know Saregama?
A bit small. Yes, small accent. I cannot. Cannot say I know, but I cannot say I don't know. That is the situation.
Everybody knows, na Saregama?
Yes.
So please you
Let
start
me say.
Saregama.
Okay, it is a Maya Malava Gavla that Sarigama is started in Kerala or in South India.
Okay, okay. In Kerala, okay, whatever the, yeah. So please start.
Pada ni sa sa ni da pa ma ga ri sa.
Bah, bah, beautiful. Again.
Ri ma pa dha ni sa ni dha pa ma ga ri sa ri ga ma pa dha ni da pa ma ga ri sa ri ga ma pa dha ni da pa ma ga ri sa ri ga ma pa dha ni sa ri ga ma ga ri sa ri sa.
Wow, beautiful. Beautiful, Gangadhar.
Thank you, sir.
Your voice is very good.
Thank you. Thank you.
Very
In
good
fact,
voice.
I got a second prize for a music competition at the university level in 1992.
Acha.
After I submitted
Oh,
PhD
that's
thesis
good.
and
Okay. So now,
But
now
what-
you sing with me. Sare, please follow me. Huh? Sare ga re ga ma pa dha ni sa ni dha pa ma ga re sa. Now you ga. Sare ga re ga.
Sariga ma ga ma pa ma pa da ni dha ni sa ni da pa pa ma ga ri sa. Is it, sir?
Yes. Now again.
Riga ma pa da ni dha ni sa ni da pa ma ga ri sa. Riga ma pa da ni da pa ma ga ri sa.
Beautiful.
It is in a Shankarabharanam. I think raga.
Okay. Okay. Now you follow. Sare ga re ga ma pa ma pa dha pa dha pa ni dhani 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 sa. Sani 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 dhani 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 dha pa ma ma ga ga re sa. You
Sari
think?
sari sari ga riga ma pa ma pa da ni dhani dhani sa ni da ni da pa da ma ma ga ri sa.
Beautiful. Again.
Sari 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 ga riga ma pa da ni dhani sa ni da pa ma ri sa.
Beautiful. Beautiful. Now,
It's
Ashita, are
really
you ready
beautiful,
now?
sir.
Hello, Ashita.
Sir, I'm going to follow up as in 5 minutes as well. But it's really beautiful how sir and you, I mean, you are just, following, such a melodious style.
Okay, so what is your experience in Melbourne? Whether the people are using Sare Gama?
Yes, sir.
Are they using Sare Gama or they are using something more different?
So the way you have been, doing singing this way only, but like moreover, they start with Om Sa, so that they have sort of the introduction towards it. More of like Om and Sa.
Acha, Om. Okay,
Yes,
Om.
sir.
Okay. Okay, so I think you know Sare Gama Padanisha, right?
Yes, sir. Yes, sir.
So please you sing Sare Gama Padanisha.
Yes, sir. So I am just taking 5 minutes. I'm sorry. I was just outside. I'm going home and then just showing you and singing as you instruct, like that.
Okay, no problem.
Yes, yes, sir.
So Dr. Gangatharan, what is your experience when you sing the Sare Gama Padanisha? What is your experience?
Sir, I am not experienced in music therapy, but it was my expectation that music can bring some changes in psychiatric treatments. And I'm a psychology PhD holder.
No, I'm not talking about your psychology and your other experience. I am talking about your current experience. So when you are singing Sare Gama Padanisha, at that time, what is your experience in your body or in your breathing system?
In fact, I didn't notice it. That is to be said so.
For example,
But
okay, you sing with me, okay, and you tell me your experience.
Yes, yes,
Then again, sa,
sa,
Ni.
Ni.
Dha.
Da.
Pa.
Pa.
Ma.
Ma. Da.
Re.
Re.
Sa. So when you are singing Saregama Padhanisha, so you have observed there is some change in your breathing.
Yes. It is calm down.
Coming down, correct? Okay. Now I will tell you, for example, if I say head, okay, then you sing head, then sa, okay. And when I say throat, then you say throat, re, okay. Yeah. So I will tell you one part of the body, and you will just tell that particular body part name, and then you follow this Saregama Padhanisha. Okay?
Okay.
Now start. First from toe. From your toe. Okay. You tense your toe, and then you say sa. So I say toe, and you will tense your toe, and you will tell sa.
Tense.
Yes, you have to tense your toe.
Okay.
Okay. Sa. So I say toe, and then you tell me toe, and then sa. Okay. And then again, I will say toe, and after that time you will relax your toe. Have you followed me? Hello. Hello. Is it difficult to you? Hello, Gangadharan. Is it difficult to you?
Sir.
Hello. Okay, so I'm saying toe.
Only head.
Okay, then you start sha.
So.
Are you sitting or lying? Hello. Hello, your voice not coming. Okay, so this is another style where you can apply the music in changing your different type of body muscle tension, body muscle relaxation. Okay, so this is one approach wherein you can apply the music in muscular relaxation. Muscular relaxation is very important, specifically for stress management. So Ashita, are you ready now?
So just in a little while as well, as I'm just reaching. I'm so sorry. I just happened to go outside, but I'm listening and actively listening towards it.
Okay. So now I am going to the next slide.
When you were singing as a listener, I just found out that when even I have realized whenever we do such sargams or anything, I think our heart rate, our conscious, our
Correct. Very good.
yes sir. So
That
I
is
think
the important part.
yes sir. So
Okay.
sometimes it is also so that when I've seen that people trying to learn music, they also feel very much anxious on the highest note since they are not able to do and they just feel very much anxious. So how to deal with that, sir?
So this is my suggestion. When you deal with any person with high anxiety disorder or the depression disorder, okay, major depressive disorder or anything, you can apply the music therapy.
Okay, sir.
And specifically the saregama, because everybody knows saregama.
Yes, sir.
And when you apply the saregama, then automatically what happens, the change will be in the breathing system.
Okay, sir.
The change will be in the heart rate system.
Right.
And you always tell the client to close the hand, to close the eyes.
Okay, sir.
And after that, you can tell the client, so whatever your experience you share with me.
Yes, sir.
Like
So,
that.
so right. So I like you said that tell them to close the eyes. So here I have seen that a lot of people with major depressive episodes, they start hitting up sad songs which make them sadder. Is it true as well for you?
No, in case of the major depressive disorder, you do not follow the close the eyes. So
Okay,
in the
sir.
major depressive disorder, you always apply the dance therapy.
Okay, sir.
So dance therapy, because the dance is the antidote of depression.
Okay, sir.
So if you apply the dance therapy, then that will activate the total body system. That will create the high level of arousal in the body system.
Okay, sir.
But in case of the anxiety disorder, the main problem is in the respiration.
Yes, sir.
So when you feel unpleasant mood, okay, and at that time, your rate of inhalation and the exhalation and your pleasant mood, your rate of inhalation and the exhalation, these two will be the different.
Yes, sir.
Okay, so what is your purpose? As a music therapist, your purpose is to restore the inhalation and the exhalation rate.
Okay.
Is
So,
it clear?
what if resistance comes from the patient or the client?
The resistance comes from psychological resistance usually comes.
Yes, sir.
Psychological resistance usually.
Yes, sir. Psychological
And when
resistance.
you find that is the patient has high desire for making suicide, etc., again there you can apply the music therapy.
Okay, sir.
Why? Because music therapy helps you to move your consciousness to the altered consciousness. In Rabindic psychotherapy, I have noted that is how the patient moves to the altered
So
consciousness.
almost.
Any idea about the altered consciousness?
I have read about it, but it would be really good if you please just reflect upon it.
Altered consciousness, that means you will be in such a mental state wherein your activities are not similar to the usual activities.
Okay.
Okay. So, for example, I dealt with one obsessive compulsive disorder patient, and that patient claps the hands. So, this is her main symptom, that is the hand clasping. So, what is my therapeutic goal? What will be my therapeutic goal? My therapeutic goal will be to prevent response, hand clasping response, prevention of hand clasping response. That will be my therapeutic goal. So what I have done, I have started one Rabindra Sangeet. I think you have heard or may not, I have no idea. The
Yes,
song
sir.
is this. Anandaloke Mangala Loke. So like that. And I am lifting my hands. Okay. Slowly, 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 slowly. And suddenly I observe that is the patient also opened the hands. Okay. And she followed all my styles of lifting the hand. And when I stand up, at that time, she also stands up. And when I move the hands, at that time, she holds my hand, and again she is dancing with me. And after that, when I sit on my chair, again she also sits on her chair and without hand clasping. Can you imagine? This is the altered consciousness.
All right. All right, sir. So basically, has this is, I mean, so amazing that you get to do the person in your own way, so they can reduce their own symptoms through the altered consciousness. So here is she. I mean, that's so wonderful that she has imitated you through observational learning. Is that so? The Skinner's theory.
No, in case of the Skinner theory, that is different. That is the operant conditioning.
Yes, sir.
So that is the reinforcement approach. But
Yes,
here
sir.
there is no reinforcement. She is
Okay.
just imitating me, and
Okay. Okay.
she is following the songs. She is following the music, because
Okay, sir.
here I am applying the music only. So this is not because there is no such goal that she will stand and she will dance with me. Because the usual response is hand clasping.
Yes, sir.
She usually spends her time in the toilet, and she has wasted the water.
Okay, sir.
She is taking food. At that time, she usually opens her hands. After that, again, she has clasped, started. Okay. So whatever her behavior, that is not the usual activities. So this state can be considered as the altered consciousness. Okay. So that is the therapeutic goal.
Okay, that's so great, sir. So basically, when you did that on that client, I mean that had a long-term effect, or just to that session effect, or little shorter effect.
Actually, I have observed her. That is during that particular setting, and if you ask me, there is a long-term effect. Sorry, the patient didn't turn to me, so I'm thinking that his patient is okay.
Yes, sir.
So I cannot tell you all the details, because if
Right,
the
right, sir.
patient will not come at that time, what I can say, I cannot say much.
Yes,
So
sir.
music therapy. Now again, I'm sharing. Music therapy is a therapeutic approach that uses the naturally mood-lifting properties of music to help people improve their mental health and overall well-being. It's a goal-oriented intervention that may involve making music. So you can improvise the music. Not necessary that is you will give them drum or give them flute or give them some instrument. Not necessary. You can make the music. They can make the music. So making music, another one, writing songs, singing, dancing, listening to music. So this is under the music therapy. So there are different types of music therapy. For example, analytical music therapy, Benenjon music therapy, cognitive behavioral music therapy, community music therapy, Nordop Robbins music therapy, the Bonnie method of guided imagery and music, vocal psychotherapy. Okay, so there are different types of music therapy. So what do you mean by the analytical music therapy? Analytical music therapy encourages you to use an improvised musical dialogue through singing or playing an instrument to express your unconscious thoughts, which you can reflect on and discuss with your therapist afterward. Okay, that means if the individual has some unconscious thought, and that is the repressed thought, which is not coming usually to the consciousness, through the music, you can take them out. That is the interesting part of the analytical music therapy. Benenjon music therapy, it combines some concepts of psychoanalysis with the process of making music. It includes the search for your musical sound identity, which describes the external sound that most closely match your internal psychological state. Cognitive behavioral music therapy, it combines the cognitive behavioral therapy with music. In CBMT, music is used to reinforce some behaviors and modify others. This approach is structured, not improvisational, and may include listening to music, dancing, singing, or playing an instrument. So it is very much structured. Okay, but in analytical music therapy, this is not very much structured. Community music therapy, this format is focused on using music as a way to facilitate change on the community level. It's done in a group setting and requires a high level of engagement from each member. So when you find that is the people are suffering from depression, okay, you try to follow the community music therapy by using the group therapy setting. Nordhoff-Robbins music therapy is called the creative music therapy. This method involves playing an instrument while the therapist accompanies using another instrument. The improvisational process uses music. So whatever you have done for the music, that is, you have given maybe one drum to your client, and again you have your own drum. Okay, so what will happen, that is, your client may follow, that is how you play that drum, and following you, the client again will play as per your format. Okay, so that is the Nordhoff-Robbins music therapy. The Bonney method of guided imagery and music. This form of therapy uses classical music as a way to stimulate the imagination. In this method, you explain the feelings, sensation, memories, and imagery you experience while listening to the music. So guided imagery is very powerful technique. And for example, you have observed that is your client suffers from some remote memories where lies some of the conflicts. Okay, then you can design some musical sound as if one boat is floating on the river, and after that suddenly the high wave is there and your boat is moving around, and you follow the change in your client. So you can tell your client that is okay. You express your feelings just by drawing. I have applied the same procedure in releasing stress among the senior people in a group setting. Okay. Vocal psychotherapy. In this format, you use various vocal exercise, natural sound, breathing technique to connect with your emotion and impulse. This practice is meant to create a deeper sense of connection with yourself. So these are the different types of music therapy. There are few music therapy elements. For example, client is very important. So who is the client? Client may include the people with mental health problem, learning difficulties, developmental disorder, neurological condition, and physical illness. They are the clients. And the music therapists. Music therapists use music within a therapeutic environment to help individuals of all ages who are experiencing emotional or mental health problems, or who have learning or physical disabilities or physical illness. Okay, so this is the important responsibilities of music therapists. Now I am coming to the therapeutic goals. Therapeutic goal means either a skill set needed to reduce a physical or mental disability, another one restoration, next one prevention, another one the promotion. So these are the three important therapeutic goals of the music therapy. Now there are different approaches of analytical music therapy. I have told you that is the analytical music therapy includes the psychoanalytic approach. So psychoanalytic approach means one sec. Is it visible?
Yes, sir.
So psychoanalytic therapy is a form of in-depth trust therapy that aims to bring unconscious or deeply buried thoughts and feelings to the conscious mind so that repressed experiences and emotions, often from childhood, can be brought to the surface and examined. So this psychoanalytic approach was conceptualized by Sigmund Freud. So Freud assumed that is, we have some unconscious conflicts, unconscious desires, unconscious drives. Okay. And as a therapist, our function is to draw all the unconscious conflicts, unconscious desires to the consciousness. Okay. And provide some insight to the client. So this is the approach of psychoanalytic approach. And psychoanalytic includes different techniques. For example, pre-association, dream analysis, and transference. So these are the three techniques very useful for psychoanalytic therapy. So this psychoanalytic therapy very much applicable for the person who is relatively cooperative, attentive, and good cognition, particularly the intelligence level, the reasoning level, so that you can apply the psychoanalytic therapy. And in psychoanalytic therapy, you can apply the music also. Now I am coming to the behavior therapy. Behavioral therapy or behavior therapy is a term that describes a broad range of techniques used to change maladaptive behavior. The goal is to reinforce desirable behavior and eliminate unwanted ones. Okay. There are different types of behavioral therapy: applied behavior analysis, cognitive behavior therapy, dialectical behavior therapy, rational emotive behavior therapy, and the social learning therapy. So these are the some of the types. And you know that is the behavior therapy based upon the experiments of Pavlov, Watson, and the Skinner. So Pavlov contributed the classical conditioning, and based upon the classical conditioning, behavior therapy includes the aversion therapy, flooding therapy, systematic desensitization. And based upon the Skinner's operant conditioning, that is the contingency management, extinction, behavior modeling, and token economy. Now this is the last one, Rabindra's psychotherapy. What is Rabindra's psychotherapy? Rabindra's psychotherapy is real-time, object-oriented, evidence-based psychotherapeutic intervention to maintain equilibrium in the consciousness layer, that is the Murto, Rag, and Saraswat. So what is this? It is a real time. That means you need not to search the psychotherapists or psychiatrists here. Okay, by using Rabindra Sangeet, you can restructure your own cognition. Or by using the Rabindric dance, Rabindric drama, dance drama, okay, or painting, or sculpturing, or drawing, you can provide some solution to your mind. You can regulate your mental state as and when you need it. For that reason, it is called the real time. It is object oriented. Evidence based. And this is the psychotherapeutic intervention. So what is the assumption? Assumption is that Ravindric psychotherapy deals with the equilibrium and the disequilibrium condition in the three layers of consciousness, that is the Murta, Rag, and Saraswat. So what is Murta? Murta is the seat of attention, perception. And what is Rag? Rag is the seat of emotion. It offers color on the object to know its reliability. And what is Saraswat? Saraswat is the seat of harmony. So there are three layers of consciousness. And what happens? So you just imagine, that is, your consciousness is just like ocean. So ocean has the two upper surface and ocean has the deeper surface. Okay. Something is floating over the ocean and some elements, they are also floating under the surface of ocean. And sometimes those elements are coming out. Okay. And when the ocean is calm and cool, for example, when you are in peace, okay, you are in calm state, at that time, your consciousness has the flow, and this flow is called the laminar flow. But when some of the elements are coming out from the deep or the under the surface of the ocean, it comes out and it changes the calm and peace laminar flow on the ocean surface. Then it creates the turbulent flow. Okay, so I have seen one patient. She is very good in the school level completion examination. She has received letter marks, and she was a very good performer also. She always kept herself calm and cool. So this is their her tendency. That means you will find some of the equilibrium state. But we have no idea what happens in her mind. Suddenly, he started abusing her parents when she woke up in the morning. Okay. And she was at that time very much aggressive. Finally, she was brought to one psychiatrist, and psychiatrist diagnosed her as the schizophrenia. So what does it mean? That means there is some conflict. The conflict at the bottom or the the surface of the consciousness. Again, it acts. Okay. So what is important? We have to understand the elements as the psychoanalytic approach. But in Rabindra's psychotherapy approach, we will not discuss those elements with the patient. So what we'll do? We will relate those conflicting areas with the Rabindra Sangeet. Okay. So this is the technique. Another technique is plotting Rabindra Sangeet experience. We can plot Rabindra Sangeet experience, whether it is pleasant or it is unpleasant. So that is the graphical distribution. Another thing in Rabindra's psychotherapy is the value. I have observed 14 path-oriented and 14 goal-oriented human values. So if you rank them, and based upon a ranking, I can understand where your locus of consciousness lies. And based upon that, as a therapist, I can assist the client to create some positive flow inside the consciousness. So that is the consciousness flow. So to sum up, analytical music therapy is very much relevant in case where the client is able to develop the insight, number one, wherein the function of therapist is to understand the locus of consciousness. And third one, wherein the therapist, the music therapist, can apply the music to restructure the cognition or the cognitive elements. So this is all about our discussion today.
That's really great, sir. So basically, I've never heard about this technique. So it's really good. I'm rather looking forward to learn and apply it.
Sure, you can apply Ravindic psychotherapy in your place, but at least you have to learn several postulates are there. And
Right, sir.
lot of the therapeutic elements are there. I presented this therapy in, you cannot think about it. I presented this therapy in China.
Okay.
I presented this therapy in Japan. I
Wow.
presented this therapy in Malaysia, Pakistan, Dubai. Okay. And I have received good appreciation. Presented the therapy in Sri Lanka, Bangladesh, Nepal. So I'm thinking that is, if I get very good student, that student can spread this knowledge, because this model is very much statistical model.
Yes, yes, sir. So it's also, I mean, it's an achievement to learn this one, because it is sort of statistically, as you're saying, and it's also very different from our regular Sargam model, I guess.
Yeah, that is true, because here the therapist has to understand the graphical distribution of the music experience. This is a very interesting thing.
So where can I learn from this very therapy?
You can learn from Ravindra Psychotherapy Research Institute Trust, and I am the president of this trust, so I am the pioneer. And you can get some of the inputs in the slide share.
Yes, sir.
And my plan is to provide the music therapy course from 25th to 29th. And there you can learn something about.
All right,
So
sir.
if
All
you are
right.
interested, you can join this music therapy course.
That's great, sir. I'll definitely take a part in and learn that.
This is a 7-day music therapy course. So if you are interested, then you can join. I am giving you the link here in the
Right,
chat
sir.
box.
Right.
So you can join.
Thank you, sir. Thank you so much. I'm just
So
joining the group.
please you introduce. Okay.
Yes, sir.
On the current registration fee, after 22nd, the registration fee is 500. But before that, it was 200. So many people already joined. So if you are interested, then again. But the program that will be held in at night. Okay. So if you
Right.
think the night is okay for you, then fine.
Yes. Yes, sir.
Okay, sir.
So now, would you like to share some of your experience, Ashita?
Sir, from this session, I've really learned. I mean, I have been looking for various sessions to be attended as a part of the research program. So there are many therapies, as you've been briefing upon psychotherapy, behavior therapy. But honestly, in our India, there is there are less of researches on music therapy, and if there are less of webinars. So I am really looking forward from you for more webinars where I can get the practical experiences of yours and the knowledge. And it's really good. The way you briefed, it's really making me feel that there is a scope in music therapy. Otherwise, most of us back out because we think that music therapy is just an additional therapy, supporting therapy. So but today I felt that from this program that I can also teach and learn from it. A lot to do.
Oh, thank you, Ashita.
Welcome, sir.
Now I am trying to conceptualize the quantum mechanics
Yes,
in
sir.
Ravindric psychotherapy. And I'm preparing one my presentation that will be presented in the International Conference of the Indian Academy of Health Psychology.
Yes,
So
sir.
there I will present one paper that is how we can apply the quantum theory of Einstein
Okay.
in psychotherapy. Because
Okay.
I have observed that there are a lot of the quantum dynamics are there, quantum physics, the principles of quantum physics, those principles are acting in psychotherapy. So this is my imagination. So I am trying to think about it.
That's really great, sir. So from this, I memorized that there was a in Talwandi Sabo, Punjab. There was last time a conference from IAAP. Did you present there? I was hearing on the screen that some resource person.
Yes, correct. IAP
Okay,
conference. Yes,
but
that
it
is
was so
true.
beautiful, and I would like to tell
Oh,
you here.
acha.
Being a musician and a therapist as well, I was the one who was looking forward towards, many music therapists, but you were the one who just sung, and in the hall full of people, sir, your presentation was really so effective. It was such a thing to just hear from you.
Okay, thank you for remembering me. Thank you,
Yes, sir.
thank you. So, Dr. Gangadharan, what is your experience?
Sir, I have one experience,
Okay.
and it was I started telling about it in the beginning. But one schizophrenic patient who was taking medication was coming with to me with the complaint that her mother told me that she is using always abusive words, and I was just trying to calm down her feelings and suggesting hearing one YouTube music of Ravi Shankar's Yaman Kalyan, Yaman Raga.
Yes,
For some,
correct. Iman Raga, right. There are
that
different ragas. Yes, many ragas are
yeah.
there. And Rabindranath Tagore did experiment on the different ragas. Dhrupad, Rabindranath Tagore applied Dhrupad Sangit, Dhrupad Rag in Rabindra Sangit also. So there are different ragas. Yes, definitely. Different ragas are there. So we can apply the different ragas in music therapy. But my point that is you always give importance on the therapeutic goals rather than the musical experience. So whenever we are attending some of the musical instrument, okay, the conference, etc. They are providing musical experience, but that is not the therapeutic experience. Therapeutic experience and musical experience, these two are different because the musical goals is different and therapeutic goals are different.
Right, so sir, I would like to say here that is why most of the patients, their parents, I mean, even the other psychiatrists, counselors, take the music therapist a little lightly sometimes in India because they think that it's a sort of entertainment. But right, the way you said that the goal is to correct the symptoms, the behavior, not to deliver the music just.
Correct.
Yes, sir.
Very correct.
So
So you have understood.
I got a singing bowl. I mean, I just tried to play that in front of autistic child and they just got very disturbed. So is that, I mean, really disturbing to play singing bowl sound?
No, it is not like that. You don't give them the instrument first. Okay,
sir.
so whatever their behavior, you just follow their behavior. Maybe they are making the sound coo, so you will make coo.
Okay.
Okay, instead of giving one instrument, you play with it. So not from any external, it should come from within. So
All right.
if your child is moving from here and there, you also move here and there. So then automatically you will change the slow movement. Then automatically you will find that is your child is also following your movement. So in this manner, you can restructure his or her movement, your patient movement, your patient behavior. So that is the approach we are following in Ravindic psychotherapy. That is whatever your consciousness. And as a psychotherapist, my understanding will be to understand your consciousness. So I will not impose my consciousness on you. But what you are doing, that is, you are imposing your consciousness, your ideas on the patient. Rather, you regulate the consciousness of your patient. So initially, whatever you can say there is a maladaptive behavior, whatever the behavior is there, but not too much risky, but relatively less risky behavior. Maybe the autistic child, they are moving from one place to another place. Maybe she is running from one place. So you also do run. And then after running, suddenly you slow. And you will find that is your autistic child will be in the altered consciousness. Again, you can regulate
Okay, sir. Okay.
So in this manner, you can make sound. You can make sound. The autistic child also makes sound, because autistic child usually likes the movement, and autistic child likes sound.
Right, sir.
So you can apply that model.
Right, sir.
Okay, so now close your hands for the closing prayer.
Sure, sir.
Purnamada, Purnamada, Purnamidam, Purna, Purnamudachyate, Purnasya, Purnamadayo,
Purnamadaya
Purnamebhavo,
Purnameva
Shishyate.
Tishyate
Om
Om
Shanti Shanti Shanti.
Shanti.
Okay, thank you.
Thank you,
So
sir.
please keep in touch with me. You will
Thank you,
learn
sir.
many things.
Thank you so
Okay,
much
thank
for
you, sir.
briefing, sir. Thank you.